Welcome back. My next guest is Dr. Keith Bennis, who is a vascular surgeon with Fayette Surgical Associates. I think I got all that right, didn't I?
Yes, Jeff, thank you.
All righty. So you deal with what we call peripheral arterial disease. Tell us a little bit about what that is, some of the symptoms and signs that we might need to pay attention to.
So in general, peripheral arterial disease, or atherosclerosis, is blockage of the artery, and there are arteries all over the body. And here in the bluegrass, the most common symptom that people will experience is pain in their legs. And the pain in the legs that we're specifically relating to is pain when you walk at a certain distance. And that pain at a distance starts to get shorter and shorter over time as the artery gets more and more progressively blocked. That progresses then to rest pain, and then eventually wounds and sores on your feet that don't heal. And those are the symptoms that people should primarily be aware of to let them know that they might have blockages, especially if they have certain risk factors: smoking, diabetes, high blood pressure, which are all common here in the bluegrass.
Yeah, in Kentucky, especially smoking.
Correct.
Yeah. Okay. Now, why do we worry about vascular constriction? What's down the line if we don't pay attention to that?
As the disease progresses, the end result, if this is not treated, is ultimately limb loss or amputation, and that's ultimately what we're trying to prevent. And we have a whole myriad of procedures that we can use to kind of prevent that from happening.
And limb loss is unfortunately can affect a lot of people.
Correct.
Now, you mentioned smoking, diabetes, all can lead to peripheral arterial disease and limb loss, amputation, but there are also some socioeconomic factors that may play a role. Tell us about that.
Correct. There's a paper that came out in 2021 published in the Journal of American Heart Association that highlighted what they call the DCI, Distress Community Index, and it's based on several factors, including high school diploma level, rates of poverty within the society, and they looked at different areas and which factors tended to lead to more amputations based on zip codes. And it was very fascinating, some of the results that they found in there. The long and short of it is, even though you might live in a metropolitan area, the access to those specialists might not be there because of people who don't know and ignorance of the resources that are available to them.
So you're talking if somebody's got pain, the symptoms, got the risk factors, they shouldn't ignore that.
Correct. And a lot of times they ignore it thinking it's just a cramp, or they just walk it off. The problem is if you walk it off for months and years, eventually by the time you come see me, there aren't many options in terms of what we can do.
Well, you talk about options. So tell me a little bit about how you fix it.
Classically, the prior procedures used to be very invasive, meaning we'd make big incisions and have to do bypasses and big surgeries like that, and you'd stay in the hospital for several days. Nowadays, since the 2000, there's been an endovascular revolution where we are now doing these procedures through minimally invasive means. Much like an appendectomy used to be through an incision, now we're doing it through laparoscopic. Similarly, in the vascular world, we use wires, catheters, and balloons and stents to restore blood flow in various vascular beds throughout the entire body.
So it can be anywhere. It can be aorta, it can be arm, hand, foot.
Correct. And just to be clear, the territory of the head belongs to the neurointerventionalists because they have specialized skills for that, and then the heart is usually the cardiologist. But every other blood vessel in the body is the domain of the vascular surgeon. We
talked a little bit about amputation. When you're a diabetic and you might have peripheral arterial disease and you see a scratch on your foot or a sore, it's important to take care of that.
Correct. And one of the hallmarks of diabetic care is to inspect your foot, because diabetes has a blessing as well as a curse in that you can't feel your feet, and so all the things that are going wrong with it are painless to you, and because you ignore it, it can continue to fester, and by the time it becomes evident, it may be already too late. Okay,
so short of operating, are there things you can do to make that disease process better?
Yes, specifically for diabetes is controlling your blood sugar. Controlling what you eat. There's a large component of that. There are medications that we can prescribe to control risk factors. specifically along those lines.
And exercise tends to help that.
Correct. And unfortunately, we live in a society where we're blessed with cars and we don't have to walk as much. And a lot of times, because of that convenience, we don't have the ability to notice that these issues are slowly progressing as we continue our daily lives. And so having an activity schedule or being physically active in some ways helps you to see these symptoms as they're starting to present themselves.
So control your sugar, control your blood pressure, take a statin if you need to, stop smoking, exercise.
Correct.
And they won't have to come see you.
Hopefully, yes.
All right, thank you again for the care you give. Thanks for coming in and providing us great information.
Thank you for this time, Dr. Fox.
All right, we'll be right back.